These days, I've had so many patients coming in saying that they have pigmentation, hyperpigmentation, but do you really know what it is and what to do about this pigmentation? I'm Dr. Anika Goyal, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. Today, I'll tell you all about hyperpigmentation and what you can do about it. Now, what are the causes of hyperpigmentation? It could be due to genetics, so maybe you have a family history, your parents also had pigmentation, and you've started developing the same. It could be due to hormonal changes, so pregnancies, menopause, any kind of PCOD. It could be due to medications like tricyclic antidepressants. It could be due to vitamin deficiencies. So commonly vitamin D, B, iron deficiencies can lead to an irregular type of pigmentation. Sun exposure and excessive sun exposure can lead to an accentuation of the natural pigment in our skin. Melasma, which can be due to many combined factors, and of course, skin type. So the darker the skin is, the more tendency there is for hyperpigmentation. Inflammatory conditions like burns, eczema, post the healing of these, you can also develop pigmentation. Now let's talk about how to treat hyperpigmentation. The first is your home care. So what you're doing at home really matters. So things that you can add on into your routine: vitamin C serum, kojic acid, creams containing licorice extract, mulberry extract, hydroquinone, but this should be under guidance of a dermatologist, retinoids. Apart from this, basic moisturizing and sunscreen is so important to prevent it from getting worse, as well as to repair your skin barrier. Along with all of these topical treatments, oral antioxidants in the form of supplementation as well as your diet. So foods like blueberries, strawberries, tomatoes, these are all rich in antioxidants and great for your skin's healing, as well as free radical damage and protection of the skin to also prevent that pigment formation. If you know you have a tendency for pigmentation or hyperpigmentation, please make it a point to reduce your sun exposure as much as possible. Now, this also includes your travel time when you're sitting in the car, if you're sitting near windows. If you can't avoid this, make sure you're doing other things to protect yourself, like wearing a hat, sunglasses, scarves, wherever possible. Apart from your home care and your topical treatments, laser treatments are very effective in treating pigmentation. So this includes targeted light therapy, which focuses on the pigment and breaks it down, Q-switch, as well as pico laser. This targets the melanin specifically that is present in the skin, breaks it down, and over time helps to brighten up the tone as well as minimize the hyperpigmentation. Apart from lasers, you also have options of peels. This your doctor will decide. Various peels can help with pigmentation, and of course Derma 4, which is great. The needling along with the creation of microchannels and the use of solutions helps to lighten the pigment over time. The number of sessions depends on the treatment and the timeline you're looking at. So you can expect for each procedure almost 3 to 4 sessions. If you're doing combination treatments, you can expect almost 5 to 6 sessions of treatments to help reduce the pigmentation. But bear in mind, it depends on the type of pigmentation and why it's happened. So of course, first and foremost,